Hello everyone and welcome to placing of the rubber dam. First of all, as we said before, we have our rubber dam material which has two ends, the matte and the shiny. Make sure to always place the shiny end towards the down and the matte end to up towards you, that is. Okay, then first of all we have to see which quadrant we want to work on. We identify the quadrant and we move the rubber dam slightly towards said quadrant in order to minimize the amount of stretching on that side. Clear the quadrant, in this case from canine to second molar of the third quadrant. So mark it with our pen and we then proceed to punch the rubber dam with the rubber dam punch. We make sure each tooth has sufficient space, so the larger the tooth, the larger the punch hole we're using, and the smaller the tooth, the smaller the punch. Then we proceed to identifying which rubber dam clamp we would be placing on the tooth. Make sure to floss the clamp properly before placing the clamp into the patient's mouth at all times. And then we proceed to use rubber dam forceps in taking the tooth and trying it into the patient's mouth without the rubber dam. Make sure that the clamp is stable and does not move a lot, and then we proceed to hold our rubber dam material. Make sure that the shiny side is towards you in this case, so we could apply some Vaseline onto the rubber dam in order to facilitate the sliding of the rubber dam onto the teeth. And then we proceed to place the rubber dam clamp into the furthermost hole that we have punched and make sure that this hole is always the largest sized punch. Then after we place the rubber dam into the patient's mouth with the clamp, we make sure that the floss is outside the patient's mouth and towards the end closest to the clamp as shown in the video. And then we proceed to place each tooth into its corresponding hole and we floss in between each tooth to make sure that the rubber dam is properly inserted in between the teeth in the interdental area. And make sure that when you place the floss, you pull from the direction when removing the floss. You do not insert and then you exit through the same interproximal area. You insert and then you pull from outside. And then we proceed to place the frame. Make sure you start with the mandible, so you place the mandibular ends first, and then you proceed to place the corners, and then after the corners you stretch the rubber dam. Make sure that it's not overstretched and you fix the rubber dam. And after we place our wedges, we proceed to snip off the ends of the wedge so it does not interfere with our operation or with our operative field. And then we proceed to floss in between each tooth to ensure that the rubber dam is properly seated onto the teeth. We should use our plastic instrument or our periodontal probe to properly remove the rubber dam material from over the wings of the clamp as shown. Do it slowly and try not to tear the rubber dam at this area. We start from the end which is easiest and then we move to the other end and slowly, so we do not rip or tear the rubber dam. And then we proceed with our periodontal probe to invert the rubber dam at the cervical area of the tooth, so as it would ensure proper isolation of each tooth from blood or saliva or water. We start at the buccal area and then we move to the lingual area using our mirror to ensure that the rubber dam is properly inverted. And as a final result, we could see that the rubber dam is seated properly and comfortably over the patient's entire mouth, covering all the teeth and showing only the teeth only the teeth on the arc we would like to work on. The rubber dam floss is placed over the rubber dam material under the frame with the wedges on the anterior teeth with snipped ends so it does not interfere with our operative field. Our rubber dam clamp is placed properly and holds and stable. I'm guessing that. Thank you for watching our demonstration of placing the rubber dam. I hope it was beneficial, and if you have any comments or questions, please direct them to me.